All right, good afternoon, everybody, and thank you for joining us. My name is Matt Lysecki, Senior Research and Policy Analyst at CMS, and it is my pleasure to welcome you all to today's webinar. The webinar is organized by the Center for Migration Studies, or CMS, a think tank and educational institute devoted to the study of international migration, to the promotion of understanding between immigrants and receiving communities, and to public policies that safeguard the dignity and rights of migrants, refugees, and newcomers. Today, we will present our recently published report, Promoting Citizenship and Expanding Immigrant Essential Workers' Access to Healthcare, Public Benefits, and Services in New York City. The report was researched and written by my CMS colleagues, Vicky Virgin, Kevin Appleby, and myself. The project was supported by a generous grant from the Mother Cabrini Health Foundation, dedicated to bolstering the health and well-being of vulnerable communities in New York, and we thank them for their continued support. I'll briefly lay out today's run of show. First, we'll have a presentation of the report and its key findings from Vicky Virgin, researcher at CMS. Following Vicky, we'll hear from Jean Bay, visiting associate professor at the NYU School of Global Public Health, with a response to the report from the healthcare perspective, followed by a response to the report from the legal perspective from Jodi Ziesemer, director of the Immigrant Protection Unit at the New York Legal Assistance Group. We'll then hear from CMS's Senior Fellow for Policy and Communications, Kevin Appleby, with a discussion of the report's policy recommendations. Following Kevin's presentation, we'll hold a moderated Q&A. So if you have questions throughout the presentations, please enter them in Zoom's Q&A portal at any time. Please include your name and organizational affiliation in the question. And with that, I'll hand things over to Vicky.
Hello, everyone. Thank you, Matt. And thank you, everyone who has joined the webinar today. I am going to present the findings of this report briefly. I can't get them all in, but hang in there with me. So let me. Okay, can everybody see? Okay, very good. All right, so the findings of this from this report, well, the focus of the report, let me start there, are New York City immigrants who are at risk of poor health outcomes. This research builds on findings from former research that shows that legal status is an important predictor of health and well-being. Earlier CMS research published also shows that New York City immigrants, that the socioeconomic profile of naturalized citizens in New York City resembles more closely that of the native born than non-citizens. And while New York City is considered to have more inclusive healthcare and social programs compared to other municipalities, immigrants are still at a greater risk of poor health outcomes than the US-born workers, and they remain disadvantaged in accessing healthcare. We look at two populations. The first one are the immigrants who are eligible to naturalize, of which there are roughly 600,000, and low-income essential workers. These are foreign-born workers in essential occupations, of which there are close to 370,000. There are commonalities between the two groups, and they experience many of the same barriers. Research that uses data from the American Community Survey for the 5-year period 2015 through 2019. This is the most recent available data at the time of the report. We use the 5-year data in order to produce more reliable estimates at a New York City neighborhood level. You can think of these estimates as being like on average over a 5-year period. So during this period, there were roughly 8.4 million New Yorkers, of which 3.1 million are immigrants. This is roughly 37% of the total city population. It's important to remember or know that this total foreign-born population is far from a monolith, particularly when it comes to legal status. So on the one hand, On the one end of the spectrum, you have immigrants who have already naturalized. That provides them the most opportunity to participate in society and also to eligible for public benefits and services that the native-born citizens are. And on the other end of the spectrum, we have undocumented immigrants who are most at risk and disadvantaged because they are, for the most part, not eligible for any public benefits, particularly health care. So you can see from this pie, just over half, 56% of foreign-born citizens have already, foreign-born immigrants have become naturalized citizens. The remaining 1.4 million non-immigrants over here in this pie are further disaggregated by legal status. We use methodology created by Robert Warren, a senior fellow here at CMS, to provide these estimates. So the largest group of non-citizens is a focus of the report today, immigrants who are eligible to naturalize. They're 41% of the of the non-citizen population. And they are, as I just noted on the other side, roughly 600,000. The next largest group are undocumented immigrants. There are 500,000 roughly undocumented immigrants living in New York City. And then this other pie, all other, consists of green card holders that have not yet met the eligibility requirements for naturalization, and other temporary immigrants such as students from abroad studying on non-immigrant visas. Let me just step back and say that the eligible to naturalize population broadly is defined as green card holders who have been here for at least 5 years. This is a map of New York City, and it's roughly 59 community districts. You can see here that the eligible population is dispersed widely. Every neighborhood has at least 3,000 immigrants who are eligible to naturalize. The neighborhood with the largest eligible population is up here in Queens. This is Flushing. The second largest spills over here into Jackson Heights and North Corona. There is also a very large concentration up here in the Upper Manhattan neighborhood of Washington Heights. Each of these three neighborhoods has at least 20,000 eligible population. So these are very large concentrations. The neighborhood with the fourth largest is this neighborhood here of Sunnyside Woodside in Queens. And the fourth largest neighborhood is down here in Brooklyn, Bensonhurst and Bath Beach. The immigrants have been in the U.S. for a long time. In New York City, over the foreign-born population have lived in the U.S. on average 22 years. Naturalized citizens have been here the longest at 28, and undocumented immigrants the more recent arrivals. The eligible to naturalize population is 20. They've been here on average 20 years, which is 15 years longer than the 5-year residency requirement. They are a very diverse group. They come from all over the world. The two largest groups by far are immigrants from the Dominican Republic and China. Together, these two groups account for close to 1/3 of the total population. One of the findings in this report is that the eligible to naturalize population is more likely to come from Mexico and Central and South American countries such as Colombia and Ecuador, compared to the West Indian countries from Jamaica, Guyana, Trinidad, and Tobago. Now, these West Indian groups are very large groups in the city, but they tend to have already naturalized, so they won't show up in the force, so to speak, of these top 10 centers. These immigrants can be of any race and ethnicity. So here I want to point out this is a percent distribution of race and Hispanic origin, and we compared those that are eligible to naturalize to the group that's already been naturalized. So building on what I just said, you can see here Hispanic pops out as having a disproportionately large share of the eligible to naturalize group compared to their share in the already naturalized, 36 compared to 26. Looking at Black non-Hispanics, the converse, um, it's an opposite type of pattern. So immigrants that are Black non-Hispanic, they're more likely to show up in the naturalized pool compared to the eligible to naturalize pool. Now, a quick note here, there are most likely well, I know for sure there are African immigrants in this in this category. But for the most part, the majority of immigrants are from the West Indian countries, and they self-report as Black non-Hispanic. One of the well-known, well-documented barriers in accessing particularly healthcare and any other type of service for immigrants is the ability to speak English. It's even a bigger hurdle for those who are looking to naturalize, because during the application process, one must be able to speak, write, and read English. 57% or over half of the eligible to naturalize population are limited English proficient. Of this group, roughly half speak Spanish, and another 23% speak the Chinese languages of Cantonese and Mandarin. Now, I want to just share here that I know that great work has been done and continues to be done in this area, but there is research that shows more needs to be done for particularly those who speak the Asian languages such as Chinese and Korean. And I also want to just stop and back up, and for all those people out there on this call that are working on the ground in this space, you know well that immigration patterns, it tends to be a churn. So just as soon as you graduate one class of immigrant English speakers, there's another class that's going to fill up. So there will always be work that needs to be done. So I hope that's not too discouraging, but it happens to be true. So the other well-known barrier for immigrants seeking to naturalize is the cost. It's $725 for the application fee. However, the U.S. Citizenship and Immigration Service, they offer relief for low-income immigrants. So for this group in here, if you have income under 150% of the federal poverty level, you are eligible for a full fee waiver. This is roughly 200,000 immigrants in New York City would be eligible for this benefit, this full waiver. This other piece of the pie, immigrants with income between 150 and 200%, we often call these the near poor, they're eligible for a partial fee waiver. So altogether, close to half, or 263,000 immigrants eligible to naturalize could access this, are eligible for this fee waiver or some type of fee waiver. I think this is an interesting point to talk about for a second, because to me, I'm very interested in this as another research question, so to speak. So I'm interested in this finding, in that, is it because immigrants that are eligible to naturalize aren't aware of this benefit, or could it be that the filing of yet another, like a fee waiver to show that you have this income, could be a barrier within a barrier? Because we all know that already the application process for citizenship is quite complicated. So I think that's something interesting we could maybe pick up later. Next in the report, we turn to low immigrant essential workers. I'm going to put this slide up. I love this slide. So essential workers were defined at the outset of the COVID-19 pandemic by the Department of Homeland Security, and they were described as workers who were critical to keeping the country running. During the pandemic, foreign-born working as essential workers were crucial in keeping the New York City economy running, often at great risk to their own health and safety. However celebrated at the time, important to stop and pause that today there are still many immigrants working in these occupations, and they still continue to have difficulty accessing benefits, many for which they're eligible. We focus on low income because they are the most disadvantaged, and they're defined here as workers with incomes less than 200% of the poverty level. So using this definition, we see that roughly 580,000 workers are low income working in essential occupations, of which 370,000 are foreign born. This is 64% of the total. The majority, the absolute numbers show that most of them work, or a large share of them work as in the service occupations. And when looking, these are broad categories, but when you look at the detailed occupations under service, you will find there's a difference even here of native and foreign born, in that native born workers are much more likely to work in the food services, as opposed to foreign born workers, who are more likely to be employed as home health aides. I want to draw our attention down here to the occupations where immigrants play an outsized role. 81% of immigrants work or are comprised, this occupation category is comprised of 81% immigrant. Again, this is a large group, so I'm going to just tell you that the majority of these workers are construction laborers. The occupation group below, 75%, and again, the top detailed occupation levels in this are drivers, taxi drivers, bus, shuttle, truck drivers, and so on. There are other important differences notable between the foreign-born workers and the native-born workers. Foreign-born workers are much older. Their median age 42, 10 full years older than the native-born. They also skew heavily male, with the sex ratio of 1.33, meaning there were 133 males per every 100 females, and a significantly larger share are married. I think this is a really interesting finding, and it points, for me, it points to it could mean or show that these native-born workers are at an earlier place in their career path, as opposed to the foreign-born workers who are older and more likely to have families. Let me see, the top 10 sending countries. The largest groups here are immigrants from the Dominican Republic, China, and Mexico. Together, these three countries account for close to half of all low-income essential workers. Below that are immigrants from Ecuador, Jamaica, Bangladesh, Guyana, and then below that, Haiti, Colombia, and Pakistan. One of the most interesting findings, I think, for sure in this part of the report, is the concentration of low-income foreign-born workers in the Bronx. Even though Queens is often celebrated as the quintessential immigrant borough, this is interesting. This is an interesting finding, and what's interesting to me, this is the Bronx, this is Queens, this is Brooklyn. So what's interesting to me here is they're not concentrated in any one neighborhood here in the Bronx. It's just this large swath. So starting up here, I'll just name off some of these neighborhoods. This is Bedford, Morris Heights, Concourse, Belmont here in central Bronx, and then Hunts Point down here in the South Bronx. So these are important findings, and they suggest that even though the Bronx doesn't have they don't have the large aggregate numbers of immigrants, I think there's a need to really focus on this borough, and even perhaps shift some resources in order to address the unique needs of this low-income workforce in this borough. And I think that I am at time. For those interested, please go to the CMS website to download the full report. And for those that would like more detailed data that they don't find in this report and would like looking maybe for something that's more customized, please feel free to reach out to us here at CMS. Thank you.
Thank you, Vicky. And now I'll turn things over to Jean for the perspective from the response from the healthcare perspective.
Yep. Thank you so much. I have listened to CMS webinars for, I don't know, at this point, probably almost a decade. So it's kind of my dream come true to be able to come here and present. So I'm going to provide just a little bit more context relating to the access to healthcare within this population. Just to generally provide very brief overview on the health insurance eligibility for New York immigrants. The most common source of immigrants for immigrants and non-immigrants alike, as we know, is employer-sponsored insurance, either directly through their employer or their family. And this is the case for undocumented immigrants who are able to get health insurance as well. Medicaid in New York, actually, before I go to Medicaid, I want to start with the ACA. So the ACA marketplace is a place where documented immigrants, by which I mean somebody who has some kind of ability to stay legally reside within the United States, are eligible to participate in the marketplace and receive subsidies. However, undocumented immigrants, including DACA recipients who we usually consider to be documented immigrants, are not able to participate in marketplace, legally speaking, even if they do not receive subsidies. Having said that, in New York, DACA recipients are able to apply for Medicaid, although not marketplace. As a result of Aliesa versus Novello, which many people who are tuning in are probably aware of, it's the highest state court decision that was made under the state constitution that said all documented immigrants, as well as immigrants who are permanently residing under the color of law, meaning they are unlikely to be deported for one reason or another, are eligible for Medicaid as long as they meet other requirements such as income requirements. Undocumented immigrants, on the other hand, are not eligible for Medicaid except, I talked about the DACA recipients, and then when they're pregnant, there is a separate state-funded Medicaid that's available to them, as well as starting this year as a result of the new state law, if they're 65 or older, they're able to obtain Medicaid if they meet the income eligibility. And then all children under 18 living in New York are eligible for Child Health Plus, regardless of immigration status or household income. The program is funded through federal CHIP funding, as well as states' own funding. So to talk about insurance gap, I wanted to talk about the two different population groups that Vicky talked about separately here. First, so among immigrants, CMS report shows that immigrants who are eligible to naturalize but has 10% uninsurance rate that's higher than the native-born or naturalized citizens. And there are two things probably at play here. One is the socioeconomic circumstances itself that actually make it hard for them to obtain citizenship, including financial burden of the citizenship application given the income, as well as limited English proficiency, et cetera. Those are also likely the factors that make it hard for them to obtain health insurance. And particularly relating to income, something that I want to highlight is, according to the report, CMS report, the median earning of the eligible to naturalize but has not naturalized population is about 30K, which is lower than the naturalized citizens, meaning they are not gaining their full earning potential yet, but at the same time higher than Medicaid eligibility limit, meaning they might not be qualified for Medicaid. And as we know, ACA marketplace premium tends to run pretty high. In New York, the average is about $656 and $451 after advanced premium tax credit. And this could be a significant financial burden. Having said that, it's important to note that immigrants with household income under 200% of federal poverty level in New York may qualify for Essential Plan, which has much more affordable premium and cost sharing. Then I want to move on to the second group, which is the low-income immigrant essential workers. The CMS report shows that 24% of this population are uninsured, and that's much higher than the previous group that we had talked about and much higher than the native-born counterpart. This makes sense given that undocumented immigrants account for the largest share of this population, and undocumented immigrants in general, 61% of them are uninsured. And again, this is not surprising given that they don't have a lot of insurance options available to them, legally speaking. And also, even if they are documented, as Vicky pointed out, given the nature of their jobs, a lot of the jobs that industries that they work in, such as food service, construction, etc., tend to consist of employers that are not large in size. A lot of them work as independent contractors, and thus, for many reasons, it's hard for them to obtain insurance through employers. So that might be another reason why their uninsurance rate is higher. Just to talk about the uninsured immigrants, particularly undocumented and uninsured, meaning they're not insurable, their access to healthcare opportunities in New York City. New York City launched an NYC Care, which is a direct access care program in 2019. That means that immigrants can utilize, undocumented and uninsured immigrants can utilize the health and hospital system, which they already could, but with a more smooth, seamless patient experience due to them now having a designated program with ID and specific fee scale that applies, as well as a customer service that helps them with navigating the system. And then there are many vital community health clinics, especially federally qualified healthcare centers, are legally required to provide care regardless of the person's ability to pay or the person's insurance status. And many of them specifically cater to immigrant population and have multilingual staff who can speak the languages of the population. And then New York has a law that's often called Manny's Law, which is New York Hospital Patient Financial Aid Law, that allows residents that are up to 300% of federal poverty level to get a discounted fee scale if they cannot afford to pay for the care. Although sort of the experience of relying on this law and seeking fee scale has been challenging for some of the patients based on the past report. I also want to talk about healthcare access barriers in general for immigrants. Overall, immigrants have poorer access to medical care than native-born counterparts, even when they're insured, because there are other barriers that they experience, which I'm going to discuss soon. But even when but it is true that for immigrants, perhaps the most significant reasons as to them having hard time accessing healthcare access clearly seems to be affordability and insurance status. So while most immigrant adults say they have had healthcare visits in the past year, 77%, only half of the uninsured immigrant adults report a visit in the past year. And immigrants, contrary to what many people believe or general public perception, utilize emergency departments less frequently than their native-born counterparts. And in fact, undocumented immigrants are least likely to utilize emergency department. The past study on the reasons for undocumented immigrants' utilization of ED have shown that vast majority, I think almost 80%, if not more, actually it might be far higher, of the utilization is for labor and delivery, which shows that unless they absolutely have to, undocumented immigrants really do not like interaction with the healthcare system, particularly when it comes to the emergency department. So I just want to talk about the other barriers for immigrants in utilizing healthcare. Limited English proficiency, which Vicky talked about, is definitely a big one. And those who are eligible for naturalization but has not naturalized have a higher limited English proficiency than native-born counterpart, and undocumented immigrants have the highest limited English proficiencies. Under the state and city law, the government agencies as well as health and hospitals must provide interpretation services, but this requirement does not extend to private providers. So you can imagine the challenges they have in accessing healthcare. Similar to health insurance, the health insurance certified application counselors working for the state or city agencies must provide interpretation services, and many of them are actually multilingual. But again, the requirement does not extend to non-government brokers and assistants. And then there's also immigrants have a lot of concern about the impact of insurance enrollment or healthcare use on their immigration eligibility or possibly deportation. This had been particularly heightened under the Trump era with the issuance of public charge rule. And given the upcoming election, I expect the fear to be, again, rising up. And the city's outreach and education campaigns have been critical under the Trump era, and continuing that effort as well as providing legal assistance would be important moving forward. And then also immigrants generally report higher rates of discrimination in healthcare setting compared to their native-born counterpart. This could be due to their immigration status or generally the fact that this population tends to have more limited English proficiency, also tend to be more racial ethnic minorities. But that is also something that requires policy efforts such as mandated training, as well as the enforcement of the non-discrimination laws that exist both at the state's, city and federal level. Thank you.
Thank you, Jean. Now I'll turn things over to Jodi Ziesemer for comments from the legal perspective.
Thank you. Sorry about that. I'm unmuting myself while trying to start the presentation. So I'm going to just dig into a little bit. I think Vicky set this up really well to talk about who the eligible immigrants are who are not naturalizing. And I just wanted to talk a little bit about why. What are some of the barriers to people naturalizing, and dig a little bit more into that. So I'm going to talk first about the response or the naturalization process. So, because I think this gives a lot of reasons you can kind of see why people may not be engaging in this process. So this is the last opportunity that the Department of Homeland Security has to really review somebody's immigration history, their criminal history, their good moral character. So it's a pretty comprehensive overview of everything that has happened in their journey to the United States and their time since they've been here. The application itself is 20 pages. It is now available to fill out and submit online, but people still, historically, it has been an application that people have to mail into a centralized government office. It's, asks a lot of questions, everything from employment history, address history, travel history. You have to list the dates that you've traveled in and out of the United States since you became a green card holder. Family history, including, all children, all marriages that your current spouse has had. So it is a really in-depth application. And so that just in and of itself is a barrier for many people just to obtain all of these data points. It can be a real struggle and intimidating. There's also 50 multi-part security questions, asking everything from if somebody has been a terrorist to detailed questions about their criminal history inside the United States. So it requires people to list all contact with police and law enforcement, requires them to obtain documentation on any dispositions and the result of any criminal charges. So, that for a lot of people is really intimidating and can be really difficult, even if they do begin to engage in this process, to actually complete it satisfactorily. As Vicky and Jean both talked about, English fluency is required for the examination. And I think that explains a lot of why people either are not able to get all the way to the end of the process, or perhaps don't engage even in the beginning steps of the process. but it doesn't explain the whole story. Certainly there are English, we saw that there was 57% of people who are eligible to naturalize in New York City do not speak fluent English, but that does leave, a sizable percentage that do. English fluency, as Vicky mentioned, is both writing, reading, and speaking. And there is an exam that requires you to read a sentence, write a sentence, and then conduct the exam itself in English, as well as a separate civics exam where there's questions asked about US history, US civics, and government, and a little bit about geography. So that, requires people to study. I encourage you to look, there's 100 questions that are on that exam. And I think it's interesting to see even native-born citizens who is able to answer all of those questions. There's also the process itself can take a very long time. So, depending on how many resources are allocated to the adjudication of these applications, it can take anywhere from about 8 months to about 2 years or more for somebody just going through the normal process to get all the way from the beginning when they submit their application all the way to the oath ceremony, which is the final step of the process where they're actually sworn in by a federal judge to become a US citizen. And so I think that also it can be really frustrating for people who are, beginning the process and having to wait and having to do many things. There's, they submit their application, they make a request for additional evidence, they have to get biometric fingerprint taken at a specific location at a specific date, they have to attend this exam and sometimes a separate interview. If they do not pass the exam, they're scheduled for another exam. And then finally, if everything goes well, then they're scheduled for this oath ceremony. So again, that could be hard for people if they are, to begin the process knowing that it may not conclude for a couple of years. And then finally, I want to talk about the fee. I just want to put the numbers out there. So it is $725 for most people to file this application. There's a slight reduction in the fee for people who are over the age of 65. They don't have to pay a biometrics fee, but it's still an intimidating amount of money. Vicky had mentioned that there is a partial fee waiver for people who are under 200% of the poverty line, but above 150%. So that kind of narrow gap of people. But still the fee is $405. So even if they're able to obtain this partial fee waiver, it is still hundreds of dollars to pay for this application. And then there is a full fee waiver for anyone under 150% of the federal poverty level, but that requires an additional 12-page physical copy only application. So you can't file the application online if you're asking for a fee waiver. And it requires documented proof of your income and receipt of public benefits. So again, that is something that can be challenging for people, especially if they're working irregularly or if they have problems filing taxes or even just receiving copies of filed taxes and employment records to demonstrate that they meet the income requirements. And then I think I don't need to say, but 200% of the federal poverty level in New York City is still fairly low income. And so coming up with the $725 filing fee, if you are just above the poverty level, can be really a barrier that is insurmountable for a lot of people. So what can be done to reduce these barriers? So I think the number one, and I am speaking from a lawyer's perspective, but I think one of the number one things that can be done to reduce barriers is really helping people complete this application, helping them understand what the process is, helping them access, either the online application and going through that, which requires some level of technical savvy because you have to create an account with the online with the Department of Homeland Security and actually then, answer all of these questions and submit both the application and evidence online, which can be a bit challenging for people, or even assisting them filling out the physical application, mailing it in, obtaining, there's photograph requirements, as well as paying the fee or filing the fee waiver. So just that sort of basic level of assistance in guiding people, helping them understand that they are eligible is really critical. And then, of course, investment in English classes, civics classes. There's often ESL classes that are specifically designed to help people naturalize. So they go through learning English or advancing somebody's English, but specifically targeting learning the questions for the civics and government questions. Literacy is a barrier, both literacy in native languages, but also literacy in the English alphabet. And I think Vicky talked a little bit about some of the populations that have larger percentages of people who have who are eligible but are not naturalizing. And I think it's not surprising that it's the populations that are not that do not use the English alphabet. That's an additional barrier to learning written English and being able to pass the written exam. There are some exemptions for people who are over a certain age and have had lawful permanent residency, their green card, for a certain amount of time. They can take the civics exam in their native language and don't have to demonstrate English proficiency, but still do have to be literate. That can also be a little bit confusing for people because it's sort of a math equation about when they're eligible to do that in their native language, and sometimes involves some advocacy to make sure that that really is honored by the Department of Homeland Security. And then many people will need, in addition to just basic information and assistance, which I think can be done by non-lawyers, non-legal staff. And I will, in my next slide, I'll talk a little bit more about this, but the New York City Public Libraries have been really excellent resources for providing that information. They often do host these specific civics classes, but they also just have general resources for people. They often have the actual application, instruction packets, and other things like that. But many people will need specific legal assistance for many different aspects of this application. So first, needing a waiver, like I said, that's a 12-page, pretty intensive overview of somebody's income and expenditures, and it requires evidence showing that somebody is low income. And then there's also this slight complication if you are calculating what percentage of the poverty level you are. So are you applying for a full waiver? Are you eligible to apply for a full waiver or only a partial waiver? And there's different forms you need to fill out for both of those things. There's also a medical waiver if somebody has a disability preventing them from learning English or taking the civics exam, or if there's competency issues with engaging in this process and being able to for example, do the interview and the overview of their immigration history. But that does require a doctor to complete a very intensive 7-page form with essay questions, a diagnosis, and requires them to do an analysis of whether the person's medical condition will prevent them from which aspects of the exam. Is it preventing them from learning the civics portion? Is it also preventing them from learning English? Is it also preventing them from being able to read or write? This is also required even if somebody has a pretty obvious disability like blindness or deafness. They still have to obtain a waiver in order to waive the portions of the exam they're not able to engage in. And that can be really challenging for people, working with doctors to basically fill out a legal form and make a legal analysis is not something that doctors are normally engage in, and it can be really challenging, and I think intersects a lot with what Jean was talking about in terms of health insurance and access to healthcare. So finding a provider that is able and willing to fill out this form, which is not covered by insurance, can be a real barrier for many, many people. And then again, this is a review of somebody's entire immigration history and criminal history. And so we often have to do requests for criminal records or immigration records for people if they don't remember some of the dates that are important to put on the application, or if there's you know, issues or problems that are lurking in their immigration past, really doing a full legal analysis of what has happened and having a lawyer assess whether they are eligible or in danger of losing their status if they apply for naturalization is really important. And then finally, gathering evidence. And I think this is something that is sometimes overlooked, but can be really difficult for people. They have to provide evidence of, you know, tax filing, criminal dispositions, evidence of good moral character. Sometimes there's questions on the exam, even about like military service, both in the United States and outside of the United States. You know, like I said, travel. So obtaining all of this information and documentation to support it can be really challenging, and often requires FOIAs and medical record searches, and you know, requesting transcripts of your taxes from the IRS, things that can be just increase the barriers for people in terms of making it all the way through this process. So how can the city and state reduce these barriers? I think really importantly, having dedicated funding for legal services for naturalization, both for legal assistance and for the supportive classes for ESL and for civics classes, that will help people overcome these barriers and assist them through the process of applying for and obtaining U.S. citizenship. New York City has in the past had many different programs that have been focused primarily on naturalization. And unfortunately, in our current budget, there really is only one program called New York Citizenship. And it is a collaboration with my organization, NYLAG, and HRA to target low-income, naturalization eligible individuals who are and really funnel them through legal services. But this is a fairly small project and obviously cannot help the hundreds of thousands of people who are naturalization eligible. So we do also try to, in addition to providing individual representation and advice and counsel to hundreds of people every year, we also do try to provide, you know, just general information and guidance and instruction packets to additional eligible people. But this is a pretty, you know, a small program at this point. There used to be a much larger project that provided legal assistance with applications through the New York Public Library system that was supported by the Mayor's Office of Immigrant Affairs. And this was really, I think, you know, I was really struck by Vicky's maps and looking at where there are the low-income essential workers in the Bronx. The Bronx has a really extensive library system. And this was one of the ways that we were able to provide lawyers and paralegals with specific language skills in neighborhoods where people are at these public institutions and help them specifically with naturalization. And unfortunately, that funding has been pivoted away from specifically looking at focusing on naturalization, has kind of expanded to doing many other types of legal assistance. And I think that's a shame. I think really having expertise both with lawyers and legal service providers who understand the process of naturalization, and these dedicated classes to do English language learning in order to pass the naturalization exam is really, really critical. All right, and with that, I'll pass it back.
Thanks so much, Jodi. I'll now pass the mic to Kevin Appleby for a discussion of the report's policy recommendations.
Hi, everyone. Can you hear me and see me? Great. Well, thanks to Jodi, Jean, and Vicky for their presentations. They've laid out many of the barriers and the problems that low-income immigrant workers and immigrants eligible to naturalize have to face. I'm going to try in the time we have left, which is not much, unfortunately, to explain to you what the possible solutions may be. And the general theme here in these recommendations is that the need outstrips the capacity and what's available on both the city, state, the local, state, and national levels. So that's a common theme in our recommendations, that we need to have greater capacity in many of the programs that are out there on those levels. First, on healthcare, Jean did a great job of showing what the barriers were there. We recommend, first of all, that the city program New York Cares be expanded. It serves about 110,000 people right now. It's a healthcare program for both, regardless of immigration status and regardless of if you're eligible to pay, which is provided in New York public healthcare. Clinics and hospitals should be expanded to include other medical clinics and hospitals in local communities in order to reach more people. There's a coalition on the state level called Healthcare for All New Yorkers that needs to be supported to work toward healthcare on the state level. And of course, on the federal level, they need, I remember fighting this fight when ACA was adopted, the Affordable Health Care Act, to allow the undocumented to buy into some of the exchanges so that they can get healthcare through that program. It was considered and left on the floor at the end of the day when that bill passed. So on all three levels, we need to look at healthcare coverage for low-income workers and for other immigrants so that they can become eligible. We can reduce costs in healthcare, reduce uncompensated care. Second issue, of course, which Jodi looked at, was legal representation. CMS did a study last year and found that there was one attorney for 1,400 undocumented immigrants in the country. 1,400 are waiting for one attorney. It shows that you need more legal capacity in this area. Action New York City is one program which provides that legal representation, but of course it needs more capacity and is unable to serve everyone in that capacity. The federal government is not really in that business of providing low-income workers legal representation. There was money in this supplemental, which is so controversial, that's happening right now, that would allow for lawyers to be hired for asylum seekers, but it's unclear whether that is going to pass, of course. In terms of language access, that's also a concern. Often the languages in which documents are in do not cover all the languages that are needed. In New York Citizenship program, which Jodi mentioned, English and Spanish are the main languages that these documents are put in. That needs to be expanded to other areas, to other languages, to Mandarin, for example, for the large Chinese population. So we need to provide language access both in documentation and certainly in people learning English. There's a program called We Speak New York City, which is a volunteer program which matches English teachers to English classes, and that needs to be expanded as well. We need to let people know about the opportunities to naturalize, the opportunities to get benefits. There's misinformation out there, certainly in the debate, we hear that in the political debate, but in terms of what they may be eligible for or how they become citizens is important. And they can use this particular study, the city can use this to reach out to the right communities. As Vicky mentioned, those in certain areas have the most eligible to naturalize. I think she mentioned Flushing, for example. That's where those resources should be directed. Corona, Woodside, where you have the most eligible. And then the low-income workers, there are more low-income workers in the Bronx, for example, than in Queens, and you wouldn't think that's the conventional wisdom. But use our study to use your limited resources to reach out to those areas, to those districts, to those communities that are most in need. On naturalization, we recommend the formation of a national office to focus on naturalization. It usually comes out of U.S. Citizenship and Immigration Services, and they have campaigns periodically, but they're inconsistent, and it's not at the forefront of the national government's priorities. Having a federal office that focus on naturalization would be something that's important and would be helpful in reaching out to those who are eligible. Also, we need to have a campaign on the waivers. Vicky mentioned that 200,000 immigrants may be eligible for waivers, but they don't know that. So we need to have a campaign to focus on that population to know that that is not a barrier for them. If they can't afford it, then they can get a waiver. And then, of course, we need the legal assistance to help them get that waiver. Couple more. We need to invest in citizenship campaigns in the city. New York Citizenship needs to get more resources to expand other populations. There's a program called from CUNY, City University of New York, called Citizenship Now, which holds events for citizenship, which has classes, English classes and others. But again, capacity is an issue. How can we promote that program in the communities? How can we make that more successful? Another sort of program to look at. In the area of low-wage workers, we can do several things. First of all, we can enforce the wage and hour laws in many of these industries, which isn't being done consistently, certainly on the state or local level. The U.S. government, DHS, launched about a year ago a program that would provide protection to low-income workers who may want to whistleblow in terms of conditions and wages in the workplace, where they'd be eligible for expedited deferred action if they cooperate with an investigation. They've helped about 1,000 immigrants at this point after 1 year. That's an important program, an innovative program that the state is also helping to promote. And that's something we need more of as well. And again, we need lawyers to help people through that process. And there is a law program called the Low Wage Worker Initiative, which has been helpful in that effort as well. Finally, I know we're running out of time. We're almost out of time. And if you listen to the current debate on Capitol Hill, this is a distant goal, but we need to reform the immigration system so that people have better chance of getting legal status, et cetera. The current influx into the city of New York of asylum seekers has sort of raised that issue even more. And one other thing that the federal government is doing, or is attempting to do, is to expedite, work authorization for many who are seeking asylum so that they can work and contribute. And that's something else that we recommend in the report. I encourage you to read the report, but also to focus on those recommendations at the end and put those into action. Thank you.
Thank you, Kevin. And as Kevin mentioned, we are at time. We'll run just a few minutes over with one or two questions, perhaps. If you want to enter those in the chat. I know some of the questions that have come in have already been addressed by the panelists and presenters. If you do have to get going, we understand. One quick question, I think primarily for Jean, but then we can turn it over to others if anyone would like to comment, is, so for the eligible to naturalize immigrant population, you note that median earnings exceed the Medicaid eligibility limit. yet healthcare access remains lower than amongst U.S. citizens, U.S. born and naturalized. What are some of the considerations of developing a program to address this issue from your perspective?
I think part of it is just like, sort of the end note that Kevin mentioned is like we need immigration, system reform. Part of it could be the overall healthcare system reform, right? Affordability is still a really big issue. And it's not just for the lowest income population. For many people who may not be eligible for Medicaid because they have a higher income than the threshold, but are still not making enough or don't have insurance through their employers. And even if they have insurance through their employers, they might have a lot of financial challenges and paying for the full cost that they require, whether it's premium or other types of cost sharing. Having said that, for that specific population, I think and I think also generally, the emphasis of the state and city so far in addressing immigrants' access to care has been, and justifiably, the lowest income bracket, as well as the undocumented immigrants, because they rarely have the options for them to be able to access to care. But I think if we were to look at things more ambitiously and looking at more broadly, I think there should be an effort to address those who may not be at that exact income bracket, but still have challenges in accessing care, and the immigrants who may not be undocumented and actually do have status. Some of them, in fact, may be eligible for naturalization, but still have a lot of challenges because of various circumstances, including limited English proficiency and uninsured status, and so getting them insurance is important, and also helping them through addressing the affordability and access needs they have for healthcare. I think that's sort of the next step that policy efforts wise that we should look into.
That's great. Thank you, Jean. Anyone else want to comment on on that question as well? All right. If not, I think thank you so much to Vicky Virgin, Jean Bay, Jodi Ziesemer, and Kevin Appleby. We'll go ahead and wrap things up. If you're on the call, thank you so much for making the time to join us today. To access the full report, please visit our website, cmsny.org. If you or your organization is interested in working with CMS to create customized profiles of select eligible to naturalize or immigrant essential worker populations within New York City, please reach out to us. You can do that at cms@cmsny.org. And thanks again, and have a great rest of the day.